First time. Here we go. All right. So, welcome everybody here to Coastal Integrative Health, where today we will be talking about heart health and kickstarting your heart health here today. And I'm Dr. James Morosky with Coastal Integrative Health here. And who am I exactly to be talking about heart health here? Well, I'm a graduate of National University outside of Chicago for chiropractic. And I've been practicing for over 12 years here now in Illinois, Ohio, and North Carolina. And really, over the years, my practice has been not necessarily all over the board, but multifaceted. So certainly, I focus a lot more on nutritional and lifestyle applications, certainly with digestion, neurological, and cardiovascular issues as well. So not just the musculoskeletal components here. And my approach is always more of a complementary approach. So certainly where the allopathic models to heart health in this regard, if I'm having a heart attack, I know exactly where I'm going. It's like I'm not going to get an adjustment or focus on nutrition at that point, but more for the chronic issues that are out there or more of management of these issues. That's really what we want to be focusing on from a complementary approach here. And a lot of what I do, I just have more of a passion for research-based care as well. So I always try and stay up to date of what's actually out there rather than giving potentially outdated information as well. And that's probably the biggest topic of this here today is going to be more of what's the latest research saying versus what was done 50 years ago that we're still doing here today. And then just in general, chiropractic, the way that I believe it to be is more the treatment of the human body without drugs or surgery. Now, the problem that we're talking about here today is obviously cardiovascular disease. It's one of the most common health pandemics in the United States, with 1 in 4 Americans dying from cardiovascular disease. And it's something along the lines of like 17 jumbo jets a day crashing for the amount of deaths that we deal with per day. And we just don't really think of it that way, but it's a shocking statistic. And again, about every 42 seconds here, someone's having a heart attack. So probably by the time that I've rambled on here, we've probably already had 3 or 4 people die, unfortunately. So that's something that we want to be changing, obviously. Now, where does chiropractic come in for our heart health? Now, the simplest one, or at least the most direct, I guess I should say, for chiropractic is the neurological connections to the heart and cardiovascular system. We've got multiple areas throughout the brain and spinal cord that lead to the heart. So in particular here, we have the parasympathetic nervous system that's up high here that controls more of the rest and digest, so more of the accommodative aspects of the heart, along with everything else that's in the body here from not only lungs and pulmonary, but digestion, adrenals, various different things. How you sweat, how you regulate your body temperatures, the parasympathetic nervous system, and sympathetic. Then we have the direct spinal connections in the upper part of the neck, but then also the thoracic spine here that go directly to the heart as well. So whenever we're dealing with kind of neurological ramifications of cardiovascular disease, that's what we're looking at, the upper neck, upper back in particular. The allopathic medicine, our conventional medical doctors, they're obviously focusing on pharmacology, toxicology for the acute setting, worked great. But when we're looking at more of long-term ramifications of what's going on, chiropractic and complementary medicine, we focus on more of the education of the dietary and nutritional aspects, and obviously the lifestyle changes to get the results that we're looking for here as well. So chronic conditions need that chronic support. So I always think of chiropractic kind of filling in the gaps of what allopathic medicine, they're keeping you alive and will keep you thriving, basically. And then anyone that's a patient here, you've probably seen this chart here throughout our treatment rooms here. And again, this is just emphasizing just all the neurological connections to different parts of the body. And we're focusing on where these two arrows are going in the upper part of the neck here for the parasympathetic nervous system, and then that junction between where the neck meets the upper back here for the direct spinal connections as well to the heart. But obviously, throughout the body, different nerves are leading to different areas of the body. So oftentimes whenever we're seeing a certain health issue, oftentimes we'll see that reflect in where the areas that we're adjusting in the spine here as well. Now, how can chiropractic, from the adjustment standpoint, help us out with our cardiovascular health? Well, obviously, we're fixing the biomechanics and the posture. So, if we are hunching forward and we have this kyphosis that's going on, the head protruding forward, we're compressing the heart. We don't get as much pumping action. We don't have the chambers of the heart fill up nearly as well as what they could be, and they have to work harder to get more blood out. So you'll see heart rate start to climb. You'll see blood pressure start to climb because it's working harder than what the typical heart should be doing. So obviously we want to correct posture, getting you more upright there. That's going to relieve a lot of pressure off of the heart, but the lungs as well too. But then there's also a few connections between bone spurs and the carotid arteries in particular that lead into AFib, or what looks like atrial fibrillation. So just irregular heartbeats. And I've got several patients that I'm treating with that do really well with a certain style of adjustment to keep their AFib in check there as well. And anecdotally, I find that whenever they drop out of care, that's where all of a sudden their AFib starts to come back, and they're like, "Oh, I need to go see Dr. Morosky again." It's like, yes, you do. And obviously, as I've harped on before, the nutritional aspects to support our cardiovascular system as well. And I alluded to the bone spurs putting the pressure onto the carotid arteries here. So particularly the mid to lower portion of the neck, about like C5 or so, we'll see as they kind of protrude out. Not only do they give us this kind of like chicken bone sensation that's in the throat, like whenever we swallow, it feels like we have something that's kind of stuck in our throat. If they're severe enough, they'll kind of certainly push into the esophagus. But even when they come off to the sides, they'll actually put pressure along the carotid sinus, which is where the carotid artery, uh, as it's starting to come up, it'll split. And right at that split is where we have these nerve attachments that register pressure, especially along those blood vessels, to let us know, oh, okay, we need to increase our heart rate or we need to increase our blood pressure. Otherwise, every time that we got up from a chair, we'd collapse, basically. So anytime that there's a pressure drop or a pressure change, it's telling the heart to do something different to help correct for that. But if we have this mechanical pressure that's always put into it, we always have this kind of background noise that's going into the nerve, and then that's what starts to cause some cardiovascular issues like AFib here. And so not only that, I'll also see a lot of dizziness issues with this as well. So more of orthostatic hypotension, where if you're getting up, that blood pressure drops down. I've already mentioned the atrial fibrillation as well. I know you usually find that this is the case whenever I'm having patients that are diagnosed with AFib, but they can have bouts of where they have a clean EKG. And they almost always have that forward head posture. So that's always my sign that I need to be working on that with this patient. And the reason that it also develops is not only just the bone spurs, but also as you shorten that nerve by bringing that head forward so far, anytime that you move the head, you start to stretch that nerve, and then that lights up the nerve, and then the heart starts to get into its own tizzy there. So correcting that posture and more or less over time lengthening how that nerve is, the vagus nerve, that'll also start to correct a lot of the heart issues for us too. Now, outside of these direct issues, even from chiropractic as well, we're always fixated on pain. It's like, how is your pain today? But at least some studies show only 18% of our nerves actually transduce pain. The other 82% out there are doing something else. So we need to also focus on function. And that's, again, the purpose of this talk, to talk about the function of everything. And with chiropractic, we're certainly not only getting the efferents, how these nerves are firing outward, but with the adjustment, it also causes a reaction that goes into those nerves as well and helps kind of restart those nerves for us. So the afferents as well. So it's getting that regularity back for us. Now, obviously, with blood pressure issues out there, one of the biggest concerns that we have is not only heart attack, but aneurysms. And oftentimes, what we'll see with patients with very high blood pressure, atherosclerosis, we'll start to see this vascular damage that shows up here for us to where we'll see this dilation of the aorta to where patients might actually need to have surgery. And I've had a few patients in the past where their pain level, they describe it almost more pulsatile. It feels like it's a throbbing pain in the back, especially on the left side of the lower back. They're older. I've got a blood pressure. It's a 150, 160 over 100, 110. It's like, okay, we take the lumbar x-rays, we see that. It's like, well, let's not adjust you here today. Let's make sure we get that under control before we get you taken care of. So there's many cases where these abdominal aneurysms were discovered by chiropractors, and nobody knew that they were there because they weren't doing the preventive care to make sure that they didn't have that either. And like I said, I've certainly had my patients, my fair share of patients that have had that, to where we have to pause our care until we get this taken care of. And then, like I said, that blood pressure is certainly a big cause for a lot of these aneurysms. So we want to talk about, okay, how can we prevent that? So again, we come back to the adjustments. We see countless studies out there that show getting adjustments, especially in the neck, at the upper neck, consistent drop of that blood pressure. So average studies, and I find that in my practice too, it follows suit with this, where I'll have about a 20/10 drop in blood pressure. So the example that's given here as these averages, about 150/95, and then having a patient drop down to 130/82. I find that's actually pretty consistent with what I get out of my care as well. And certainly if I have somebody that's very high, like I said, the 160/110, even after that adjustment, they're still going to be high. So we want to look at some other nutritional interventions or medications, if they're not already on any, to help bring that down additionally as well. Now, the big one I always like to talk about is cholesterol. Cholesterol is an animal in and of itself, and there's a lot of information that I need to cover. So I actually go to, I apologize for how old this this PowerPoint is, but I did make it like 10 years ago here. So it is like PowerPoint 98. But cholesterol, it's just waxy, kind of fat-like substance that we have in the body, but it's an absolute necessity that we have cholesterol in the body. We don't want to eliminate all of it there. And otherwise we are dead. So what we're looking at is balancing cholesterol. Cholesterol is not the end-all be-all in my book. Whenever I have a patient get cholesterol tested, and especially if they're high, I say, okay, well, what's your CRP? And I usually get a blank stare whenever I ask that. And C-reactive protein, that's actually measuring vascular inflammation. That's the bigger kicker for us. That has a bigger indication of cardiovascular issues for us, a CRP, versus just high cholesterol. I've had patients where with a cholesterol of 300, their CRP is a 1, they're not having a heart attack. I've had patients that are marathon runners with a cholesterol of 100, and they've had heart attacks, but their CRP was about like 60, 70. So inflammation is the bigger indicator here for us. Actually, if I remember correctly, the doctor that found the relationship of cholesterol and heart attacks back in the 50s, 60s, and started the advent of statins, he came out in the early 2000s and said, no, my research is wrong. He's like, we need to be focusing on inflammation. And he actually worked pretty close to where I ended up first working in Ohio. And I think it was about the year before I started, that's where he came out and said that. And the hospital said, okay, we're going to kick you out. They ended up forcing him to retire. And they ended up giving out a statement, which was kind of sad, that they were like, we are dedicated to research of cardiovascular health, and we're top notch in what we do. And it's like, but this is the lead researcher, and he's humble enough to say, I think my research is wrong. We need to investigate this more. And I feel like he ended up being correct in it. Now, cholesterol, like I said, it's used in everything. So it's not just bad cholesterol and good cholesterol. Cholesterol is used for a lot of different things. So the one that we're always focused on is the one that we have circled on the slide here, cholesterol esters or lipoproteins. So LDLs, HDLs, that's what you'll usually see on your cholesterol panels. But not only will we get cholesterol from what our body ourself makes, but dietarily as well. But diet only makes up about 20-25% of actually what our cholesterol is. So even when we change our diet, it doesn't actually change our cholesterol for the better in the long term oftentimes. But whenever we're limiting cholesterol from these lipoproteins, it's going to start to affect our digestion with our bile salts. It's going to affect our vitamin D levels. Almost all my patients that are on statins have low vitamin D significantly compared to patients that are off of them. We'll see steroids that our body makes will be diminished as well, and hormones will be diminished as well. So we'll see, I'll see a lot more endocrine issues like thyroid issues, adrenal issues, pancreatic issues, and more diabetes issues. So even the medication that is for cardiovascular health could potentially cause diabetic-like symptoms as well, or metabolic syndrome. But then I'll certainly see more of membrane malformations as well with cholesterol being reduced. So that leads into leaky gut issues and digestive issues. So it just is this slippery slope of statins. Now, coming back to cholesterol, so most people, like I said, we have cholesterol in our body, and we should have cholesterol in our body. And on average, we make about a gram of cholesterol in the day, just made by ourselves there. And only our diet, like I said, is about 20-25%, and that's the only part that the statins are actually working on. So you still have about 75 to 80% of your cholesterol that's not being affected by the statin drugs that are working on that HMG CoA reductase pathway. And uh, so oftentimes we'll see, okay, it drops down, but then we see it come back up, and then we see this endless cycle of, oh, we need to start messing with what medication that we're giving you, or how much of a dose of the medication that we're giving you. And that's usually the indication of we shouldn't really be focusing on the cholesterol there. So that's usually where I find that the allopathic model does fail for cholesterol. So like I said, we're focusing on the dietary aspects here, and the medication aspect. So whenever we see that our dietary intake is high, our body's going to be smart. Our body is always smart and stupid at the same time. So in this case, it's smart. Where if we get a lot of cholesterol in our diet, especially healthier cholesterol, I'm not saying go out and get McDonald's here, but if we're getting good healthy fats, good healthy proteins, your body's not going to rely on making cholesterol on its own there as well. But then likewise, if you're reducing your cholesterol intake and you're on statins, you got to have cholesterol somewhere, and it's going to start pulling it from your cells. And that's where we start to see a lot of this degradation that occurs. So like I said, we have this degradation where cholesterol starts to get pulled from a lot of different cellular membranes. So we'll see it be pulled from the intestines, from the brain, anywhere that has a high fat content. That's where it's going to start to pull it out from. And one of the worst case scenarios that we have, I don't see it nearly as much, where doctors will replace saturated fats with unsaturated fatty acids. But what ends up happening with that, it ends up being a bigger slippery slope, because cholesterol will replace the saturated fat that surrounds our actual cells, our healthy cells, keeping them nice and tight. Cholesterol comes in, it's fairly good at what it does, but when unsaturated fatty acids come in, they're very permeable. So things will just kind of slip in and out of the cells very quickly. And then particularly with the gut, that's what leads into leaky gut issues and digestive issues. And here's a rudimentary drawing of what ends up happening. So we have a healthy cell on the left side here, just kind of going along, doing its thing. But then we have where the statin comes along, takes out that saturated fat and the cholesterol that's there, and then it starts to be much more permeable. And the cholesterol should come along and actually fill in that gap and make it a nice, healthy cell again. But again, over time, if we're reducing that cholesterol or the saturated fats and the dietary cholesterol, and you don't have enough cholesterol to make the fill in the gaps here, then that cell starts to become more permeable, and it starts to lead into cellular destruction as well. And then we have bigger issues at hand, particularly like with nerve function here. Just kind of touching on it quickly, about 1 in every 2 cells that are in the myelin sheath that's covering around our nerves is cholesterol. So if we start reducing our cholesterol and start pulling it out from heavy or high cholesterol areas to kind of fill in the gaps of other functions, we're going to start to have these nerve issues here. And there's some studies that are indicating that higher cholesterol actually lowers your chance of Alzheimer's disease. It's still a little early yet to say it definitively, but I've seen studies where it's almost non-existent for people that are 300 to 500 for their cholesterol. Again, I don't know if I want to advocate that, but there's that ratio that's there. So it at least shows us, at least functionally, that cholesterol is playing a role in our nerve health. And I've already kind of beaten it down here. Intestinal wall integrity, that will be degraded with statin drugs and low cholesterol, which leads into leaky gut issues, and then leads into all these inflammatory conditions as well, which then leads into the cardiovascular issues here. And as I mentioned before, our cholesterol, it makes all of our hormones in our body. So testosterone, estrogen, progesterone, DHEA, which is sometimes called the anti-aging hormone. So it's a precursor to a lot of different endocrine organs there as well. And again, increased levels of DHEA in our body decreases our likelihood of cancer, decreases cardiovascular disease, diabetes, obesity, Alzheimer's disease, and even it's a good indicator of premature death if it's low. So if we're taking this away, it's like, well, we're just putting ourselves on a ticking time bomb here. And like I said, it goes on and on here as well. And yeah, and then the Framingham study here, it was showing that there wasn't really a significant difference between higher level of cholesterol and lower levels of cholesterol and cardiovascular or cardiovascular diseases and incidents. And now there are some indications that there's an anti-inflammatory effects from statins, which again leads into this inflammation case here for us of why maybe it's effective. And then just a few things to kind of nitpick as far as the statin statistics. Lipitor, one of the most common ones that are recommended, they claim a 36% reduction in heart attacks with their drugs over the course of 3.3 years. But if you actually kind of dig into the raw statistics, it works out to be about 3 out of every 100 people that had the placebo had a heart attack, but it was 2 out of 100 instead with Lipitor. So it's like, if you break it down, it sounds really good, but it's not really all that significant, I feel like. So we got to look for a better way here. Like I said, we want to focus in on more of anti-inflammation here. And skipping ahead here. We'll say a lot of cellular destruction, and this is really where the start of atherosclerosis comes in. So the LDLs, they'll come in with the immune system already starting to try and repair it, but they'll kind of cross interact with each other. And then that's what causes this atherosclerosis and these plaque developments here to where they'll start to kind of thicken up and then eventually to where they'll become necrotic and gross to where they'll break off. And then that's where we have thrombuses and blood clots that develop. So like I said, we want to focus more on inflammation. Obviously, we look at acute inflammation here in the office here. Obviously, ones that we would see would be where there's swelling, redness, increased body temperature in an area that's damaged. When it's inside, we don't necessarily see it nearly as much. And then again, with chiropractic, we'll see a lot of chronic inflammation. And even with inflammation, it's related to about 7 out of 10 of the leading causes of mortality in the United States as well. And again, a few other issues that are commonly associated with inflammation. Arthritis, we see it. Heart disease, this is what we're talking about. Alzheimer's disease, there's evidence of it. Osteoporosis is sometimes triggered by it. Fibromyalgia is more of inflammation of those muscles and nerves. Metabolic syndrome, diabetes, that could be inflammation along the kidneys or from the immune system leading into this cardiovascular disease and then into the diabetes. Gut inflammation with IBS or irritable bowel syndrome. Inflammation from toxicity can lead into toxicity. Kidney issues with nephritis, cancers. It just goes on and on here for us. So coming back to our big talk here. Skipping ahead. There we go. Now this is where the fun begins. So now we want to be talking about what can we do to correct a lot of this. Now on this chart here, pretty much everything in red is everything that we talked about here. I skipped on a few things here like AGE. Those are basically crystallizations that occur in the blood vessels from like diabetes. So this is again just that destruction of the endothelial tissue, the tissue that surrounds, that actually makes up the blood vessels itself. So there's obviously a lot of different areas that lead into the endothelial dysfunction and issues here. So let's get right into it here. So nitroglycerin, one of the most underappreciated medications that's out there that it's easily accessible for a lot of patients here. This will almost sound like it's going to be an advertisement for nitroglycerin or nitric oxide, but it's that nitric oxide that really helps out our blood vessels here. So we'll see where it'll cause dilation of the blood vessel, so it actually opens up the caliber, the hole where the blood flow is coming in through. So that'll help us reduce that blood pressure for us. It helps bind oxygen to our tissue, so we get better oxygenation out of our tissues. It's been shown to be cardiovascular protective from cell damage, and even cells that have been damaged. It helps bring them back to life to some degree there. I've seen rat studies where they did infarcts on blood vessels, so they cause destruction of blood vessels, reintroduce blood flow, and add nitric oxide to certain rats and certain and the other ones didn't. And they see about a 30, 40, 50% improvement as far as vascularity into that destroyed cellular structure. So there's a lot that goes on with nitric oxide. And nitroglycerin was the forerunner for our discovery of it. And excuse me, and that loss of nitric oxide is also associated with atherosclerosis. So we naturally make a nitric oxide, but as we get older, especially once we're in our 30s, that's where we'll start to see we're less productive at making our own nitric oxide. And this might come in from our dietary standards here in America, or it might just be our natural metabolic processes here as well. But we want to be able to reverse that, because as we start to lose that nitric oxide, we'll see that inflammation and plaque buildup, and then the arteries will start to stiffen to where they're less responsive to to the heart pumping. So that increases our blood pressure to the point of where it causes that cellular damage, and we have a rupture, and now we've got a big issue at hand here. And obviously, we always talk about diet and exercise. Well, we can't exercise if we're out of breath all the time. So that nitric oxide can actually help us improve our exercise capacity as well. So if we have more nitric oxide, that means we have more blood flow. More blood flow means more oxygen, and we can exercise longer and harder and get more effect out of it as well. So what are causes of cardiovascular disease? Cholesterol? Not so much, but smoking, that's a definitive one, causes inflammation along those blood vessels. Poor diet, yes, especially if we're getting a lot of foods that we're allergic to, or if we're getting a lot of dyes, or I'll usually find especially the food allergy testing could be very worthwhile for us. Poor oral hygiene, oral infections. Interesting note, flossing your teeth reduces your likelihood of cardiovascular disease about 30 or 50%. I forget the exact statistic, but it's not insignificant. So be sure to floss. But on the counter of that as well, mouthwashes decrease our bacteria in our mouth, especially if they're more alcohol-based or Listerine. And that killing off of the bacteria, especially beneficial bacteria, some of those bacteria are actually responsible for creating that nitric oxide. And there's some studies out there that show in healthy 30, 40-year-old doctoral students, they're taking mouthwash, they'll have high blood pressure, they come off the mouthwash, blood pressure returns back to normal. And that's the only change that they've made. And they'll see that result within just several days, basically. So look at your mouthwash. Sedentary lifestyle, yes. I mean, if we're not exercising, if we're not testing the limits of our cardiovascular system, that leads into a lot of the degradation of our cardiovascular system. Inflammation, yes, totally. Drug therapies, yes, certain drugs will, for as much as they're trying, will sometimes cause a lot of these cardiovascular issues as well. But again, the common denominator for treating a lot of these issues here, nitric oxide. Now, a few other things that can be done. My tried and true is always looking at purification programs, diet, or looking at toxicity throughout the body. And the reason that I like this is not only is it just treating it with an herbal or a supplement, but it's also looking at correcting the dietary aspects here. So in the United States, our diet is just terrible. So we want to look at correcting that. And especially with Standard Process, they have a plan to kind of get these toxins out of the body there and make a wiser options there, and having a long-term plan going forward, especially with like a whole foods diet in particular. So like I said, it puts us on a healthier pathway going forward. And we have the added benefit of having a jump start to weight loss as well. And a lot of studies show that visceral fat leads into less inflammation. Something called interleukin-6 is highly potent in adipose tissue or fatty tissue. So the less visceral fat that we have, the less inflammation that we have as well. And then I've talked about nitric oxide. The one that I've just been in love with has been human Neo 40. And as try as I might, I'm looking at trying to get it here in the office. It just doesn't make sense cost-wise. So I just recommend patients, look it up on Amazon. just really simple to use. So not only is it helping us out with the circulatory issues that we've been talking about here today, helping repair cardiovascular damage, increasing the blood vessel caliber, so it helps lower that blood pressure. And interestingly enough, I had concerns about, does it drop normal blood pressure or people with low blood pressure? It does not. So it only seems like it affects when that hypertrophy is occurring and we have high blood pressure, but not anybody with normal or low blood pressure. And there's some evidence that it stops and sometimes reverses atherosclerotic damage as well. It just depends on how early that we're getting to it. But nitric oxide, it's vital for immune function as well. Where I became introduced with it was actually during COVID as well. And I ended up seeing where I started to get some twinkles of nitric oxide for cardiovascular health is where I believe it was in the UK. It was UK or Canada. They started giving Viagra for patients with COVID, and they responded really well to it. And that's nitric oxide. So yeah, helping out that immune function, but preventing a lot of the inflammatory aspects there as well. It seems like it's a win-win with nitric oxide. And then it also helps improve that blood glucose concentration. So it can help us out with some diabetes as well.
Nitrous oxide prescription?
So with this, you can it's a supplement, so you would have direct access to it, so you don't necessarily need a prescription to it.
Vitamin store or Walmart.
Yeah, so you'll see it commonly like beets, like beetroot, as far as like the nitric oxide donors. The only problem that I have with the beets is if I see results with it, it's like, okay, I know that this would work with it. If I don't see results with it, I might see results with this because this is a little bit more complete. So it's nitric oxide, nitrates, and nitrates, which, oh gosh, it's like I can go down the rabbit hole of nitrates as well. But I'll save you guys that. But so this one's a little bit more complete. So with beets, you're only getting one piece of it. So you could see results with it, but you can see more results with
If you
nitric
eat
oxide.
beets, it's the same as that. Is that what you're saying? I hear you say beets.
So beets is probably the food that I would recommend to get nitric oxide, but it's really just the nitric oxide, but there's nitrous oxide, nitrate oxide, nitrite oxide. And so like with this supplement here, it's a little bit more complete. So you get a little bit more of the complete effect.
What is the, I'm sorry.
Mhm. Yeah. So
What
it's
is the amount that you should be looking at? 100 milligrams, 200, 300?
and that's kind of where the problem with like using just beets kind of comes into play. It's that one's not standardized nearly as much with this company here, and there's a few other companies out there that are actually developed by about the same guy here as well. He's got it standardized, so his dosing ends up working out to be where if it's more of a severe setting, he's ending up starting patients off with 2 per day, so like 1 every 12 hours to kind of keep the effects going. And then once we kind of hit a good threshold with it, we're seeing good oxygenation. We're seeing better results as far as our blood pressure being maintained. Then he drops it down to about 1 a day. And it's certainly safe enough to take long term there as well. Because like I said, you'll see a lot of benefits to it. And as we're aging, we're producing it less. So it's one of those supplements very similar to like vitamin D, omega-3s, where it's like, oh, we're not producing it nearly as well as when we age. And it tends to be a big nutritional deficiency. So it's usually good to just kind of keep up with that supplementation as well.
Well, not today, but I came back from my cardiologist. I'm 86 years old.
Mhm.
And she said, you're in excellent condition. Just keep doing what you're doing. Cardiogram from last year to this year were about the same. And it was in good health. But my wife has a little problem with cardiovascular. And I was just wondering if this would help her.
Yeah. Really, the only contraindication that I've come across with nitric oxide supplementation is blood thinners that are for treatment of an active blood clot. If we have an active blood clot, we don't want to be causing dilation of that blood vessel because then it can dislodge and go through. Now, you could be on blood thinners if it's more of like platelet issues and such, and it's being monitored. But if there's an active clot, that's not what we want to be doing it with. We want to make sure that that gets stable first, and then we can move into nitric oxide later down the road.
No blood clots.
Yeah.
Sorry.
Oh, you're fine. You're fine. So yeah, final considerations. So this is just more of my kind of hodgepodge of everything here together. Whole foods diet, especially local produce ends up being best. One thing that I thought was just such a big paradigm shift for me was organic versus inorganic. Uh, Inorganic, or I don't want to say inorganic, but non-organic food, where they have utilized nitrogen fertilizers, actually have higher levels of nitric oxide in them as well, in fruits or in vegetables here. Um, so it's almost better to go with kind of conventionally grown produce. And I think we're fortunate here because there was a study that showcased 5 major metro areas. It was LA, Chicago, New York, Austin, and Raleigh. And typically it was Raleigh had some of the highest levels of nitric oxide in about like 5 categories of produce, um, especially for non-organic food. So this also comes down to, okay, do we want to get the pesticides and the other potential harmful aspects of non-organic food? So again, that's where we come back to, do we want to just supplement with it? Because there's even still foods out or produce out there that doesn't have the high enough levels of nitric oxide. So we still might end up needing to supplement with nitric oxide. And in that same study, they looked at the DASH diet, or the dietary approaches to stop hypertension. That was beneficial to us as long as we were focusing on vegetables that were high in nitric oxide. The Japanese diet was also all around a good one as well. But the standard American diet was the one that obviously did the worst. So certainly looking at changing up our diet is a key factor for us. And I've already brought up the alcohol-based antiseptic mouthwashes and flossing here as well. How that affects our blood pressure and heart attacks. Diminishing our inflammation. We touched on this with the cleanses that we can do. We can look at doing that. Food allergy testing. That we have take-home tests that we look at about 132 different food allergies that cause chronic inflammation that lead into a lot of these cardiovascular issues. I alluded to earlier, I had a patient, well, actually I had 2 patients that were marathon runners. One was vegan or vegetarian, and the other one was just a general healthy diet, but they both ended up suffering heart attacks. And like I said, they were healthy. Low cholesterol, doctors couldn't figure out why they had the heart attacks. And just out of curiosity, we ended up doing the food allergy testing on them. And they were taking turmeric for anti-inflammation, but it just so happened they both were highly allergic to turmeric, and that's what was causing the CRP, the inflammatory markers, to be so off the wall for them. Once we took them off of or got them off their turmeric, we retested the CRP at like a month or 2 later, and they dropped back down to like, I think 10, something like that. So it was like, okay, that was definitely the kicker there for us. Exercise, the emphasis is on cardiovascular, but we don't want to forget strength training as well, just to keep muscle tone up as well. The more muscle tone that we have, the better we utilize our cholesterol as well. So then we keep the cholesterol bandits at bay, basically. Supplementation, if we had concerns about nitric oxide, niacin is another good one to help open up these blood vessels. So I'll often see patients that are taking like a B complex for energy. And we take a look at it. Their B6 is ridiculously high. The niacin is okay, but we'll see like B6, B9, B12 being very high. But B6 causes vasoconstriction, so it can increase our blood pressure as well, where niacin actually dilates the blood vessels and can help us lower blood pressure. So oftentimes, if I'm doing the neck adjustment on patients to help lower their blood pressure, and they're right at that borderline of still being high afterwards there, I'll put them on a niacin regimen, and then that'll help me get the rest of the way with a lot of those patients as well. And then there's certain herbals as well, but those are more on a case-by-case basis as well, because obviously there's going to be drug interactions that we have to be concerned about, and there are more so the drug interactions are probably more so what I'm concerned about, and then whatever our goals are the herbals that I'll focus on as well. And then otherwise here, guys, that is the end of the talk here.
A lot of doctors